name's Clay Hargis. I am an emergency room physician at Mount Graham Regional Medical Center. I have been here for 13 years. I am currently the pre-hospital medical director for Mount Graham and then the EMS medical director for Eastern Arizona College. And I previously served as the emergency room director for 6 years prior to that. Arriving in emergency medicine actually was something that I had the example of my father to be able to just kind of go before me, and I remember he actually gravitated, even though he was a physician, surgeon, family practice doc, and then he actually eventually ended up in emergency medicine. But he started off in agriculture, so he actually went to agriculture and went to went through veterinary medical school for 4 years, became a Green Beret, was a soldier in Vietnam, and then came back after that experience and went into medicine, went to medical school, went to surgery, but then he kind of backed off, and then he found his love. After all of this searching, he found his love in emergency medicine. And so knowing that I was a lot like my dad, I said, like, you know, why not just kind of like go towards something that I know that I would love, because I saw my dad's love for it and I knew that I would love it, and so I've used his life as kind of like an example of what to pursue. I graduated from Safford High School in 1986, and then I went for a year to Eastern Arizona College. I went on a 2-year mission, after which I came back and went to 2 additional years at Eastern Arizona College. Then, actually no, I just went to 1 year. 1 year of Eastern Arizona College. Then I went to BYU for an additional 2 years, and from there I applied to medical school. And that actually took me 2 years to apply to medical school. My first round I was unsuccessful, and I spoke to students previously about that I only applied to MD schools my first round. Very competitive year. It seems like every year is a competitive year for medical schools. But my second round, I applied to both MD and DO schools, and I was able to get into some DO schools. And then I went to medical school for 4 years. I actually started off in family practice as a family practice residency, thinking that I was going to come back, kind of take over for my father and his family practice here in Safford. And along the way, I joined the Army to be able to pay for medical school, and went to Iraq for a full year. And it was in Iraq that I just kind of fell in love with emergency medicine, and really gained a lot of the skills that I would need to be able to come back and be an emergency medicine physician. So after coming back from Iraq, I knew my course was set. I came back here and signed on as an emergency medicine physician back in 2005, and I've been full-time staff here ever since then. So now over 13 years, going on 13 and a half years. The biggest piece of advice is that along the way, as you contemplate a career in the health sciences, whether it be in medicine or dentistry or physical therapy or podiatry or whatever field you choose, that you just kind of like have patience in yourself regarding the long run that really is a marathon. And when I looked at, considering I graduated in 1986 and my dream was always to come back here, it took me 19 years to be able to do everything that I needed to do to be able to gain my experience and then come back here. And so you're really playing a long-term game. I use the analogy of and I shared it with you guys earlier, about just being on the bench. When I played for Eastern Arizona College at basketball, I started off at the very end of the bench, and then through the opportunities were just given to me to be able to get closer. And the way that our coach had it set up, that the people that got the most playing time were right next to him, and the people that got the least playing time were at the very end of the bench. And if you could consider, I was like past the water boy. I was like way at the end of the bench. But slowly I worked my way across the bench by just getting better every day and just staying in the game. And then slowly I got my opportunity to be able to sit right next to the coach and get the most playing time that I could, because I was looking for that opportunity to be able to play. Now the same analogy it fits for medicine. Sometimes you just like, you feel like you can't, that this isn't for you, and there's good thoughts to that, to be able to say like, this isn't for me and this is for me. But if you want to do medicine, if you want a successful career in the healthcare field, you've got to be willing to be able to sit on the bench and continue to be able to work on that opportunity to get playing time, if you will, to get an opportunity, like to step into the batter's box. If a baseball analogy, it takes so much for you to be able to step into the batter's box and have the opportunity to take the MCAT and apply to medical school. It takes a lot to be able to get that moment, just to have a swing at bat. And just being focused on giving yourself that opportunity to be able to apply to medical schools and healthcare professional schools. That's what I would recommend. And the second thing that I would recommend is like, go with what sticks. I would say like, if you kind of like, especially when it comes to undergraduate programs and things like that, like if there's a certain area of study that you really enjoy, make sure and make that part of your undergraduate experience. You don't have to be a microbiology major to apply to medical school or another healthcare professional school. You go for areas of study that you really enjoy, and you'll naturally be good at them, and that will give you good grades so that you can apply to medical school and not be burnt out by the end of the pathway.